And as I think most of you know, Diana is the executive co-director of the statewide Parent Advocacy Network, which is SPAN from New Jersey, and it's New Jersey's PTI. And Diana is also the director of the Region 1 Parent TA Center. So that's the East and Northeast U.S. Parent Technical Assistance Center. Diana has been a civil rights attorney for over 30 years, and she is the parent of adopted children ranging from 16 to age 32, 3 of whom have special needs. And she is the proud grandmother of a 2-year-old. So, Diana, welcome and thank you.
Just one thing, I'm the co-director of the Region 1 Parent Technical Assistance Center because Deborah and I, who are the co-directors of SPAN, are the co-directors of the PTAC, and I couldn't and wouldn't want to do it without Deborah. I am going to be talking today about the parent center role in systems change, and I'm enthusiastic about this. So I'm also a Cajun, and Cajuns, we talk really, really fast. So the symbol that I will recognize if I am talking too fast is this, okay? You know, so let's practice it. Okay, so that'll give me a good warning that I should slow down. My dad didn't speak English till he was started public school, and they washed his mouth out with soap, you know, so he would speak English. And to his dying day, when he talked English, he was very reserved and like this, you know. And when he was French, and his hands were all moving and everything. But I do like that in English too. So I'm really, really pleased to be here today. And I also, one of the things I like to do is I like to have questions along the way because I know you're not going to be able to pay attention to anything if you've got a burning question that you want to ask. And I am absolutely not the total living expert on this topic. It's something that we learn every day by doing. I love that poem last night, you get proud by practicing. You know, you do systems change by practicing. You do everything by practicing. And so, we practice together. So I love this. I actually have this picture in my office. And I started having it in my office because I worked with Cadre and the IDEA Partnership and Jan from Wisconsin Facets and some others on something called the Creating Agreement modules, which is about how parents and professionals can create agreement. And we use it in that workshop because the top represents the positions we all take when we go into a meeting, and underneath is all the real interests, the things that really drive and motivate us. But I like it for this workshop too, and I added it last night, so it's not in your slides, is because when we talk about what we do as parent centers, the top of the iceberg is the children and families we're able to help. And underneath the water, underneath the radar screen, are all the parents who don't know about us, can't find us, are afraid to try and find us or to reach out and do something. So when we do systems change, we're doing things that impact not only the top of the iceberg, the families who do reach us, but also all those families and children who are in the water drowning, but haven't been able to reach out to get our help. And so I think it's really important that we participate in systems change. So what is systems change? Well, I'm going to give you 3 quick examples before I tell you the definition. So everybody here knows that human beings are, each person is a system. So my daughter, who's 16 now, my youngest daughter with special health care needs, 2 years ago wanted to go to China. This is my daughter who spent most of her first year of life in and out of the hospital being put into ice because her temperature was going up so high. She catches a cold, it's like pneumonia tomorrow. And so she's like, Mom, I really want to go to China. I've saved up my money to go to China. I really, really want to go to China. And she's half Filipino. Oh, she's Filipina. And so I said, oh my God, you'll be so far away. You're going to be in rural China. There's no healthcare systems out there. It's really terrible. And she said, Mom, I'm going to have to do it on my own someday. I can take care of myself. I know what to do. I know how to, I can tell somebody, I'll take my medication, everything will be fine. And I said, yes, that's systems change. This system changed. Let her go to China. Didn't make her call me every day on the cell phone. Once a week, yes, but not every day. Okay. Doesn't that sound like systems change to you? When I first moved to Montclair, New Jersey, where that's Deborah also lives in Montclair, when I would go talk before the Board of Education, there was one board member who used to turn his chair like this, literally. Right? Now the Montclair Board of Education pays SPAN to come in and do workshops for parents and principals and teachers and school teams. And this year, when they did their strategic plan on special ed and 504 and how to spend their ARA dollars, they invited me and Deborah there. That's systems change. Not that they love us all the time, but. And then the third example is when IDEA 2004 passed, and we lost a lot of things in IDEA 2004. We lost a lot of protections. And we organized parents. We got 500 parents to testify about the special ed code changes. We had our top 10 things we wanted to save. 8 of the 10 we got short-term goals and objectives for everybody. 45 days, not 45 school days for exclusion. It's really hard to have an IEP meeting without having it in person. So that's systems change. We impacted a system. And the last example I want to give is last year we were part of a coalition that passed legislation for paid family leave. So now a parent of a kid with special needs who needs to take time off because they are adopting a child, or their child is born, or they have some surgery, or something has to happen that they have to take time off, it's like they get unemployment insurance, essentially, for the time they take off. That's systems change. Systems change is making positive changes by changing laws or policies, procedures, and attitudes that impact many children and families. And when we engage in systems change, we make all those systems that touch our children more proactive and positive and responsive to children and families. And it helps us go upstream to find out what's making all those kids end up in the river, instead of just trying to go into the river and save a few that are drowning. And so, to me, that's systems change. Now, why should parent centers care about systems change? Well, for one thing, if you look at IDEA 2004, in the congressional findings for IDEA 2004, they say that parent training and information activities help parents by supporting parents as participants in partnerships that improve early intervention, education, and transition services and results. If you're improving something, what are you doing? You're doing systems change. You're changing a system for the better. So the congressional findings say that's one of the things we're supposed to do. We're also supposed to help parents participate in school reform activities. We're supposed to help parents help their children achieve high, challenging academic standards. All of those things cannot be done without systems change, because the systems, the way they're set up now, don't do that. They don't do that. And there's also support from the U.S. Department of Education for this. When the first state improvement grants came out and the U.S. Department of Ed said, if you want this money, states, you've got to contract with your Parent Training Information Center, that was bringing the parent centers into the systems improvement activities. And that's systems change. Right now, the national and the regional parent TA centers, we're part of the communities of practice, we're part of the Technical Assistance and Dissemination Network. We go to those conferences with all of the professional technical assistance providers. And we now, for the last 2 years, are the ones who analyze the Part B Parent Involvement Indicator 8. That's a change in the U.S. Department of Ed, because they see us now as a resource in a way that they never saw parent centers as a resource before. We're at the table now. And that's a big change. There's lots of systems change opportunities in the work that we do. providing input into federal and state laws and regulations and policies. And, you know, there's a limit to what we can do with federal dollars. There's a limit, you know, in terms of lobbying. There's a limit to what we can do in actually impacting legislation. If we only get federal dollars, that's a good reason to charge for your workshops to professionals, because it gives you money that you can use for lobbying. And on our website, we actually have a link to a teleconference that we did around the rules around lobbying. Participating in our state performance plan annual performance report process. How many people here are from a parent center that participates in your SPP APR process? Okay. All right. Good. So that's systems change. How many people here sit in their state special ed advisory council or have someone from their parent center sit in their special ed parent advisory council? How about state monitoring teams? I'm going to call on you 1 second. State monitoring teams. Okay. And how many people here help families become involved in all of these things? Okay. Yes, Larry. Of course, I had to call on you now just took a bite, right? I always do that.
Hey, Diana, I wanted to get clarification from you. Did you say we charge for workshops, we utilize that money as unrestricted funds?
Absolutely.
Because I thought we had to, like, if we use our PTI staff to provide that workshop, that we had
If
to
you're
go back into the...
If you use people who are paid for with PTI dollars on the time that they're on the PTI, then you should not be, they should be doing it at night when you're outside of your PTI work, or you should be using per diem trainers. What you do is you do trainings that aren't required by your PTI grant. So we have a lot of workshops. When we write our PTI grant, we have a certain number of workshops that we do, and anything more than that we do, we charge. We charge for all the workshops that we do for professionals, and we charge, and if a district wants us to come in and train their parents and they don't want to open it up to the whole county, we charge for that too. And we have per diem trainers that aren't on our PTI staff, or we have our staff that's not full-time on our PTI. So they're doing these workshops outside of the scope of their PTI work. Yes. And last year, now, you know, when Deborah came to SPAN like 12 years ago or whatever, and it was her idea to do that, and all of my staff were like, oh my God, we can't do that, that's so terrible. Last year, we made $100,000 doing workshops. $100,000. The first year, we didn't make $100,000. The first year, you know, districts were calling my board and saying, you know, you used to do this for free, this isn't collaboration. But luckily my board was on board. So it took 10 years to get to 100,000. But that's 100,000 in unrestricted dollars, which is fabulous. That's how I pay our half-time policy director with training money. So. Now, the State Performance Plan and Annual Performance Report, now let me just start off by saying, this is not what we had hoped for. Those of us who were advocating for some kind of systemic way to analyze the performance of states. It's not the fabulous tool in every state that it should be. But there's ways that we can use this ourselves in our organizing around systems change. So even if your state SPP stakeholder group is not interested in hearing from you about what should go into their annual performance report and their recommended activities, you can still use that framework to go out and do focus groups with families, to collect information, to have a survey monkey on your website, to collect data that then you can feed into a variety of places. You can feed it into your state board of ed, you can feed it into your legislature, and you can also use it to organize parents, to be more active. And so even though it doesn't always result in the kind of systems change we're looking for, it can be a platform for other kinds of systems change. One of the things that's most important is that a lot of times states think that the only thing we know about as parent centers is what? What do they all say we know about? Indicator 8, parent involvement. You're the PTI or the CPRC. That's what you're about. But you know what? We know about transition. We know about dropout. We know about disproportionality. We know about early childhood. We know about young outcomes for young children. We know about positive behavior supports. And in fact, we often know more about it than the professionals. We're bringing more of the research that we're finding out about the national conference or the regional conference or through all the emails that get sent out or your regional newsletters. We know a lot more than a lot of the professionals do. And so we can share those strategies for improvement that the professionals may not be aware of because of the resources that we have, the direct connections we have. And one of the things that we've tried to do as the National and Regional Parent TA Centers over the last 6 years is connect the parent centers more to places like Cadre and the National Secondary Transition Network and the National Institute for Urban School Improvement and National Center for Culturally Responsive Education Systems, so that we all do have access to the best research on the kind of strategies that work. So when we're sitting at a table and somebody says, well, why don't we do this? We could say, well, you know what? The research says this. Maybe we should try this instead. You know, in a lot of states, having read a lot of these Indicator 8 reports from states, the parent survey process is weak and not really reaching a lot of underserved families. It's often underreporting in terms of families that don't speak English or families of color, low-income families, et cetera. And so through our networks, we can use those surveys and get them to those families and help those families understand them and answer them, and then again, feed that information into some policy advocacy. And of course, unfortunately, states don't have to report out their determinations on the compliance status of individual districts in our states. Some states do and some states don't. But it is public information. It's available through the Freedom of Information Act. And so we can get that information from our state, and then we can let people know. These are the districts that have been found to need intervention, and these are the ones that need significant intervention, and these are the ones that need assistance. And so we can do that role even if our states are not fully addressing the needs that parents and advocates have for information about how districts are performing, or in the early intervention system, how early intervention programs are performing. This is one of the biggest areas, obviously, that we can participate in systems change, and that's around implementation of IDEA, helping influence state regulations. How many people here have your own state law or state code in addition to IDEA? Okay, so a lot of you do. So what that means is every time IDEA is revised, that's an opportunity for you to engage parents in systems change to make sure that all the basic protections of IDEA find their way into your regulations, but that in addition, the things that we may have lost say in IDEA 2004 are protected within your state. And also to be proactive. For example, we did a survey of all the parent centers in our region and found out that many of them require their districts to have special ed parent advisory councils, and our state didn't. So in addition to responding to their proposal, we also recommended some of our own language. And guess what? We now have a requirement to have special ed parent advisory councils in every district. Because 500 parents testified, and we also had something like 10,000 people who submitted in our SurveyMonkey that they thought it was a good idea. So we can influence our own regulations. And one of the good things is that if you have state regulations or state code, it's not legislation, that's not lobbying. So that doesn't count as lobbying. So you don't have to worry about any lobbying restrictions. And of course, we can also help ensure awareness of new rules. How many people here think that parents in your state know and are told by their district about their new right to revoke consent for special education? Right. So that's a role that we can play too, If there's a law that changes things and it's not being implemented because people don't know about it, when we let people know about it and help support them use it in positive ways, that's systems change. And we do that all the time. Now, I'm not going to go into a lot of detail about ARRA. I did a whole workshop on this at my regional conference. But the American Reinvestment and Recovery Act has sent districts practically double their IDEA Part B dollars in this IDEA ARRA money. And that money went basically straight to the districts, and states did not really have any authority to do anything about it. And so they could give recommendations to districts about how they might want to spend the money, talk about priorities of the state, but really each district had the ability to decide how to spend these dollars. So some of the things that we can do as parent centers is we can try and help influence the guidance that our state gives to districts. And our state, sent out really good guidance to districts, and they tied it, this was one of the things we had recommended, they tied it to the indicators, the SPP APR indicators. And there's actually a chart where you can see the SPP APR indicators and some of the federal government's recommended use of ARRA funds. So our state sent out that guidance to districts, which was great. We can also share information with districts, especially either if we're a CPRC, the districts that we're working in, or if we're a PTI, maybe some of our larger districts that impact large numbers of children, share with them information from the U.S. Department of Education about suggested ways to spend that money. Because a lot of those suggested ways are great and really would benefit students with disabilities. Doing a chart where you compare the SPP APR indicators in that district with those recommended uses, and go to that district and say, look, here's an area where you're really not doing very well based on the data, and here's some suggestions directly from the U.S. Department of Education about how you can use that money to address that indicator. And if you can get those districts to spend dollars in that way, you're changing that system. You're changing how dollars are going to be used to impact children with disabilities. It's also systems change if we educate parents on that relationship between the ARRA funds and the SPP APR indicators. If we let parents in districts know, here's where your district is on the SPP APR indicators, and here's some suggested ways to use the money, they can go in and work directly in more districts than we can as a CPRC or as a PTI. And then another big thing we can do is we can reach out to districts and show how the trainings and technical assistance that we can provide could help them use ARRA dollars in positive ways to impact their SPP APR indicators. God, APR, all these initials, it's like, So, we sent out a letter to every district in our state, 640 of them, and we did a little chart that showed all the SPP APR indicators and the recommended uses of the ARRA funds by the U.S. Department of Education, and then our workshops that directly relate to those uses. And we sent it out like 3 weeks ago, we've already gotten 6 districts that are interested in having us come and do, for money, they're going to pay us with ARRA dollars to do training and technical assistance for parents and professionals around those indicators. And that's systems change. It's systems change in 2 ways, because one is we're changing districts' perception of us as parent centers. Oh, you guys are those people who help parents, They're changing what you're changing. I say, oh, you guys are strategic and smart and systemic and have a lot to offer to help me improve. And then the other way it's system changes, we're going in and helping them improve. So the first time we think about as a parent center, systems change, a lot of times people will say, oh my God, that's so intimidating. How can I fund it? How can I take on that activity? It's so hard. It's so much work. We're already overwhelmed with all the work that we're doing now. Any of that sound familiar? Oh my God, you're asking us to do this other thing. We all provide training and technical assistance to families. But how do we do it? When we talk to a family about the IEP, Do we talk to them about best practices and research-based information? Do we connect them to resources that are relevant to having high expectations for their child with a disability? Do we remind them that the IEP has to contain research-based interventions? And do we tell them where they can find that information? That's systems change. Because we're changing the way in which we, as a parent-center system, provide training and technical assistance to families. If we talk to parents about opportunities for them to be engaged in public policy advocacy when we're doing our training and technical assistance, that's also increasing the capacity that we have for systems change. We do something in our state where we got a grant a long time ago from our DD Council to develop something called Parents Engaged in Public Policy. And it's a parent guide and a workshop. And we do that on a regional basis every year, 4 to 8 times a year. And we just invite all of our mailing list, all the disability organizations, the PTA, everybody we can think of. And we take everybody's contact information and we put them on an action alert network. So we had been doing that for several years after when IDEA 2004 happened, and all we had to do now, we had this action alert network of thousands of people who had come to these workshops over the last number of years, who already had been trained in how to write good testimony, who to contact, how to find out information. And so it was like this, it was easy to motivate, it was easy to get them involved. And you know what, you can do that as part of your training, and that's not lobbying either. Training parents about how to be engaged in public policy advocacy is not lobbying. It's not about specific legislation, but you're building a base of people who can be involved in activity when things come up that you want to engage them around. Collecting, analyzing, and sharing data is important, and of course, representing the parent voice in policy. And one of the things I think that's also important for parent centers to do, I think we have a habit of thinking that the only people who can really represent the parent voice are our staff. And the more parent voices that are out there that have the capacity to be on these different kinds of committees or meet with legislators. Last year when we were working for that paid family leave, I didn't meet with any legislator. My policy director didn't meet with any legislator. We had about 40 parents that had gone through our Parents Engaged in Public Policy training, and they're the ones who met with the legislators and told their individual stories. I didn't have to meet with anybody. They didn't even want to hear from me. They wanted to hear from those parents who were directly impacted by it. But you've got to build the capacity and incorporate it as part of your everyday activity. So if you do those kinds of workshops, and so maybe you're a smaller state and you don't have as many people, maybe the first year you do one workshop. You build your network of people that know how to do this effectively. Now, our name, the Statewide Parent Advocacy Network, which I didn't choose that name. Diana Cuthbertson, who's the founding director, did. But that word scares a lot of people, the word advocacy. It scares a lot of people. People say, well, advocacy, that's like those lawyers like Diana, Yeah, people laugh nervously when it hits the bone, right? But advocacy is something we do every day. Has your garbage, somebody missed picking up your garbage? You ever call the municipal government because your garbage wasn't picked up? Or because there's a big pothole right in your road? Or your neighbor's dog won't shut up? Anybody here called any level of government to do that? Right, yeah. Well, that's advocacy. Advocacy is advocating for something to change. The only difference between that, between our child advocating for a later bedtime, right? The only difference between that kind of advocacy and public policy advocacy is that for public policy advocacy, it's not just about us. It's to benefit a larger group. And the people that we're talking to are not the garbage collector, but the legislator who can pass the legislation, or the state board of ed member. And I remember the first time I was getting ready to go meet with the legislator, and somebody said, they put their pants on one leg at a time, just like everybody else. And they also go to the bathroom. Okay. they fart and belch and everything else, And sometimes that really helps. You think, okay, yeah, they do that too, so why should I be intimidated by them? And some of these slides I'm not going to go through because it would be too long. But when we think about systems change, we have to see ourselves as leaders and agents of change. We are not just people who are supporting parents. We could support parents until the cows come home in this part of the country. And we would never stop having the parents coming and coming and coming and coming. Because we're never going to be able to help every single parent. As long as that policy is still the same, well, the parents are going to keep coming. They're going to keep running into a dead end, even when we try to give them information and training and support. So we have to see ourselves as leaders and agents of change. And we have to see every parent that we talk to as a leader and agent for change. About 5 years ago, we started changing kind of how we approach the idea of parents and said every parent who calls us up is a potential leader. They're a potential leader in their family, in their community, in their school, in their district, in the state, in the country. Every single parent is a potential leader. Even if they're having terrible, terrible situation, we said we're going to stop being paternalistic. We're going to stop saying, oh, that poor parent, they can't do anything for themselves. Because that just plays into the same stereotypes and mythology about parents that the larger system has. When we start seeing that every parent is a potential leader and that they can be a leader and agent for change, guess what? They respond. Many of the parents who went and met with legislators last year about family leave are parents who are enmeshed in horrible situations, and not just the school system. But they made a law pass in New Jersey that helped thousands of families, and they feel a lot better and more strong and more powerful because they played a role that helped others instead of always being the one who has to be asking for help. Helping people understand how systems fit together. I mean, I don't know about y'all, but the people who call our warm line now, they're not just calling about education. There's 100 systems that their children are dealing with. The child welfare system, the juvenile justice system, the healthcare system, the child behavioral health system. All of these systems. And the systems fit together. And us helping figure out ourselves how those systems fit together and helping parents see that is systems change. Also, helping the systems see how the pieces do or don't fit together, that's systems change. So when we talk about systems change, one of the most important things, I think, is not just about us impacting policies and procedures, but engaging families and involving the people who are most directly impacted. Not only is it more powerful in terms of the people who we're trying, the legislators and the Board of Ed, et cetera, but it also is more powerful in terms of the parents who are directly involved. And we also have to reflect the society that we're working for. So we have to make sure that when we're engaging parents in systems change, that we are engaging that full rainbow of families in systems change, and not the ones who have the college degrees or who are the most articulate and don't need a lot of our support in order to become effective. We have to draw strength from and also be accountable to the families that we're working with. And I know every time that I go into a meeting, I feel like on one shoulder I have the weight of the families that I'm accountable to, but on the other shoulder I have the strength of the families that I know are ready, willing, and able to work together with me and with others to make good things happen. If you just go in with that weight, you just can't do it anymore. You get overwhelmed. You've got to also draw that strength. You have to model collaboration. This is not always easy. There's a lot of turf out there, especially in this day when money's drying up. There's a great book out now that talks about the most effective advocacy nonprofits. And it says the most effective advocacy nonprofits are not the ones that spend all their money on infrastructure, on their own infrastructure. They're the ones that spend the most time and effort on collaboration. When we worked on paid family leave, we did it with a large coalition, and it wasn't just about children with disabilities. We wouldn't have got it if it was just about children with disabilities. We got it because it was a much larger group of people, and it was a much larger group of people who were going to benefit from it. Working in coalition and collaborating with people, that's what made it happen. And we have to hold ourselves to high standards. And this, this is hard. It's hard work. I'm not pretending. All the things that we do are hard work. But they're also, if we hold ourselves to high standards and if we really collaborate with others in doing it, they can really make us feel great because we accomplish things. Now, one of my favorite people is Frederick Douglass. He said, I try to think of this every day, those who profess to favor freedom and yet deprecate agitation are people who want crops without plowing the ground. They want rain without thunder and lightning. They want the ocean without the roar of its many waters. The struggle may be a moral one, or it may be a physical one, or both, but it must be a struggle. Power concedes nothing without a demand. It never did, and it never will. That rock is the status quo. The status quo doesn't change unless people make a demand on the system to change. And it's got to be a demand that's a meaningful demand. It can't just be you and me going to the bathroom and saying, oh my God, or walking up and down the hallway and saying, I just got off the phone and this is what's happening and can you believe this, that, and the other thing? And then, I can't wave my magic wand and say, oh man, that's terrible. Let me fix it, I'm a lawyer. I still can't wave my magic wand and fix it, right? So it's got to be a struggle. There has to be a demand. It has to be organized. It has to have follow-up, has to have, I would say meat to it, right? But I'm a vegetarian, so I'll say broccoli. Broccoli is a very good vegetable for you, by the way. It really has to have power behind it. And so we have to be pushing that rock. If we're not pushing the rock with a lot of people, then the rock's not going to move. There's a law of motion that talks about that, Like things that are not moving are not going to move unless something moves them. That's really not how it goes. That's a paraphrase. Now, I just want to talk a little bit about the stages of change because this is really important. And I think many of you will recognize some of these stages of change, not just in the work that we do with parents, but also in our own personal lives. So the first thing when somebody says something has to change is denial. Nothing has to change. Everything's fine. Everything is good. You're a problem. You're the problem. The system's not the problem. You're the problem, right? If I wait long enough, the system says, you'll go away. And you know what? 9 times out of 10, it's true. 9 times out of 10, it's true. So they have learned that's a positive behavior support for them. They've learned that they wait long enough, we go away, and nothing ever happens. So we've got to keep pushing even in the face of that denial of change. And so the second one is resistance to the change. And usually what this says is, if you would only stop riling those parents up, there wouldn't be a problem. If you would just let parents know how hard it is for us to do this, then there wouldn't be a problem. If you would stop having high expectations for your child, then it wouldn't be a problem. Anybody heard that before? Okay. And a lot of times, guess what happens when we hear that? It makes us feel bad, and what do? We say, oh, all right, and we turn away. Because nobody likes to have people think, I know people think that doesn't bother me, but it bothers me too. When somebody says, if you, Diana, just stop doing that, I'm like, oh no, don't say that. But if we keep pushing, then we get to the part where they have to explore the change because they can't get rid of us. We're still pushing that rock. The problem with exploration is that usually they're going to try and manage it. So they're going to say, what's the least we can do to get them to stop pushing that rock? So they say, well, if we did this little thing, would you stop pushing the rock? And we have to kind of think about it. Is that enough of a push? Is that enough? Does that get the rock off enough in the right direction or not? But if we keep pushing, if we have enough people that are pushing, then we get to the place where we're talking about collaboration. And that's what happened with our state special ed code. We had enough people pushing, and it wasn't just parents, we had professionals too. General ed teachers who said, you know what, we need short-term objectives. Those are important for us. We really need those. And that was great, and that was powerful. So then you get to the point of collaboration, and of course the next thing, this is the C I really hate, compromise. But this is where you're making that decision. Is it a big enough change that it's going to be positive? Is this the best I can get right now? Is this going to set a stage for something even better down the line? And if so, then we're going to compromise. If it's not a big enough change, then you don't compromise because you don't get anything, you don't get enough out of it. But it is something that we have to think about. And then the last thing, and this is something that always happens, is we think we've got something great, and then we say, okay, our work's done. And we forget all about implementation. Maintaining momentum. Just because the policy has changed on paper, does that mean that the policy is going to change in practice? Parents can unilaterally withdraw their child for special ed right now. How often is it happening? How much do parents know about it? It's not happening because parents and districts don't know about it. And so maintaining that momentum and making sure that that change is implemented is important. Now, I'm not going to go through this. I just want to say one of the things that we do when we're thinking of any kind of policy campaign is we do, we have an organizational strategic plan, but we develop a strategic plan for the systems change work that we're going to do. And we bring together stakeholders, our staff, our volunteer parents, other parents, professionals, partners that we work with, and we go through a strategic planning process about what we want to get accomplished. And there's information in your handouts about things like, what do we want, who can deliver it, what do the people, so the legislators or the policymakers need to hear, who do they need to hear it from, how do we get them to hear it, and what kind of resources do we already have. But the thing I want to talk about is when you're thinking about that strategic plan, you always have to build in some little victories along the way. I mean, if you're trying to win something big, it's going to take a long time. And if you don't have any victories along the way, people are going to get frustrated or disheartened. And so you identify those little victories along the way. So when we were trying to get our state special ed code changed, the first thing that happened was the state came out and said we're going to have one public hearing. It was either the week before Thanksgiving or the week before Christmas in New Jersey, in Trenton at 3 to 5. Now, if you don't work, you're picking up your kids, and if you do work, you're not off work yet. So the first thing in our strategic plan was we're going to get them to hold at least 3 regional hearings at a variety of times and places, in different times of not just the week before Christmas. And so we were able to win that. So we had a lot of people focusing on that and won that. And then people were energized, like, wow, we got the State Department of Ed to have 3 hearings. Actually, I think they had 4. Instead of 1, we can really make a change. And then people were excited about the possibility of doing more in terms of the special ed code. So small enough to matter. The first win has to be small enough to matter. I mean, small enough to achieve, but big enough to matter. So small enough that you can do it, but big enough to make a difference. So a lot of times people will say to us, oh my God, all the parents that we work with, we can't engage them in systems change. They're so overwhelmed. And the truth, it's true. It is hard. How many people here are having fewer people show up at your in-person trainings? Right? So, we got two-parent working families, or we have single-parent families. We know the research says that kids with disabilities are much more likely to grow up in a single-parent family. It's usually the mother; she's working too. So we do have people who are really struggling, sometimes working 2 jobs to put food on the table and to take care of their children. But what we have found in engaging parents who are struggling in systems change activities is if they believe the issue is important to them and their family, if they believe that they have something to contribute, that they personally can make a difference, that we can't do it without you, right? That they're going to be listened to and their contributions will be respected and that their participation will make a difference. In other words, that we're going to get something good out at the end of it. We've had a lot of success in getting a lot of parents to be involved. And there's a lot of different ways that people can participate. But I want to talk now just a little bit about leadership. A lot of times we think that leadership just arises. And, you know, for those of us who are older and more experienced in the parent-centered movement, it did happen for a lot of us that way, right? We were advocating for our own children, and we, you know, just began to be more active and advocate with other parents on issues, and it just kind of happened that way. But we're now a more mature movement. The gray is there. And so we have to build new leadership. And we also have to have leadership that's representative of the children with disabilities that are out there. And increasingly, that's not middle-class, well-educated families. Increasingly, that's children of color, children that are immigrant children, children that don't speak English or whose parents don't speak English. And so we have to make sure, in order to make sure that the things we're advocating for are the right things for everybody, we have to make sure everybody's part of that leadership in helping decide what to do and helping to make it happen. So we have to nurture new leadership. We have to identify, we have to develop plans to identify potential leaders and build their capacity to be leaders. And also allow mistakes. I mean, you know, I remember my daughters when they were little, and they would start walking, and they would fall down. Now imagine if you scooped your kid up every time they fell down when they were a little kid, and didn't let them walk until you were absolutely certain that they wouldn't fall down. Would they ever learn to walk? They'd be 28 years old, going, oh, you're carrying around, you know, making sure that they're not going to fall down. And what really happens is they turn 16 and then, man, do they fall down. Yeah, right. Had that happen. Okay. Learned a lesson from my first kid. So we have to let new leaders make mistakes, and that's leaders in terms of our staff, and also leaders in terms of the parents that we're working with. We made mistakes. We don't like to admit it. We're not going to talk about it in public. But we all made mistakes, and we learn from those mistakes. That's the only way we learn. It's from our mistakes or learning from each other's mistakes. And we have to make the space. You know, if I had said last year, okay, Peg and I are going to go meet with every legislator about paid family leave, well, where was the space for the other parent leaders? So by making the space for them to be parent leaders, now I've got these parent leaders that are like dynamic and fabulous, and they just got a law passed. They were sitting in the front row when the governor signed the bill, right? So we have to make space. And, you know, people have told me that, you know, I take up a lot of space. So I have to be very conscious about making the space. And I think there's a lot of people in this room who take up a lot of space. And, you know, we felt like we had to because there was a lot of space to be filled, you know. But now we got to bring in more people to help us fill that space and provide that support and listen to the things they're saying and respond. Because, you know, if parents come in to be leaders and work with us and we don't listen to what they say, we say, well, oh, we tried that. That'll never work. We did that, let's see, what, 20 years ago, you know, 8 years ago, 2 years ago. That'll never work. Well, then why should they bother? Why should they bother? Because obviously we know everything and we don't need their help. One of the things I think that's really interesting is that people think of leadership, they think of leaders as being people who are, you know, inspirational and effective speakers and, you know, they can do everything and they're marvelous and fabulous. But there's a lot of different kinds of leaders and a lot of different kinds of leadership qualities that are important in making systems change. There's some people, like people who might be standing at the podium, who challenge the process at every step of the way. There are other people who are fabulous at inspiring a shared vision. They're quieter. They may not be the ones who are at the podium, but they're the ones who are going around and talking to people and getting people to recognize where their commonalities are. Other people who provide the supports that people need to act. They say, you know what, you want to go talk to the legislature? We'll do childcare here, so y'all can go do that. And people who model the way and people who encourage the heart. And this last one is so important because this work is hard. It is hard. It's rewarding, but it's hard. And so our heart has to be encouraged. Our heart has to be in it because that's the only thing that keeps us getting up in the morning is the fact that our heart is in what we do. And there are those people who can really connect us. I have a staff member named Mercedes Rosa who every time something else needs to happen, she does a lot of work with underserved families, Latina families, and she'll come to me and she'll say, Diana, I know you can find the money. This is what has to happen. I know you can do it. Absolutely, yes, you can do it. Miraculously, so far, it's worked. But she's encouraging my heart. She's letting me know she believes in me and that she really thinks I can do it. Communicators, team players, problem solvers, also being self-aware. And this is really, really important. Leaders, we have to know ourselves as leaders. We have to know who we are, what we're doing here, what are our own individual goals and purposes and expectations and motivations. Why are we motivated to do this? Not just what brought us to the work when we came here, but why are we still here? You know, there's a lot of people in this room who no longer have children who are in the school system. And yet they're still working just as hard and still just as committed. So what is it that's keeping you here? What strengths do I bring and what challenges? I still remember I was like 26 years old and somebody came to me and said, this was before I was in this field, I was in another, I think I was doing welfare rights organizing, and somebody said, you know, you're really intimidating. I said, no, that can't be. Because I'm so insecure, you know. I was like, oh my God. And I didn't really believe it like for the first year, you know. So that's a challenge that I bring, right? And it's something that I have to that I always have to be aware of and work on. And, you know, it's not something that I'm ever going to solve, but trying to work on it is important. You know, what's the best use of my leadership skills? And then how can I make space for other people? And that's always a question each of us has to ask. How can I make space for others? And one of the things that we've found a lot in terms of leadership development for systems change is that a lot of times it starts with that individual advocacy. We help somebody learn how to advocate for their individual child. Then some of them want to volunteer and help, and then others are interested in public policy advocacy. And we have a whole, you know, like I said, parents engage in public policy advocacy training that we do that goes through all this kind of stuff, laws and regulations and how the different institutions work and who are the decision makers and the formal and informal decision making, you know, because on paper it may say this is how the decision gets made, but that's not really how it happens. So, you know, we need to talk about that. Barriers and solutions, qualities of effective systems, what are the existing resources that we can use? And then skills like empathy and listening, being good communicators, being able to read things and understand them and help other people understand them, collaboration and building consensus around things, problem solving, helping resolve conflict, strategic planning, growing new leadership. These are all advocacy leadership skills. Now, when we talk about moving forward from today with all of you and thinking about systems change, I think one of the first things that has to happen is that we need to think about our own organizations and our own role in systems change. So what I'd like you to do at your table now, just for a couple minutes, is talk among yourselves about some of the ways in which some of the things that you've done, either in your organization or in some other capacity, that's been a systems change activity. And what have been the things about it that have made you feel good and the challenges that you face. So let's just take like 3 minutes. So 5 minutes, because some of the tables are bigger. If you're in a small table and you want to go to another bigger table, you can do that. Is that okay? Can people do that? 5 minutes? Okay. So just about a minute. So I think we're going to come back together. I know everybody hasn't had a chance to tell all your great stories. So how many people shared a systems change activity that they felt was effective, at least in part? How many people shared a systems change activity that you think was effective, at least in part? And come on, raise your hands. I know some of you had some stuff that you did that's effective, at least in part. And how many people were sharing things that, well, you don't know yet? A lot of hands. And that's how you see, instead of asking the question, how many times did we fail? I always say, we don't know yet. About that, we don't know yet. Because we're still working on that one. The first thing we tried didn't work the way we wanted it to. But we don't know yet because we didn't give up. We're still doing it. Reverses and restraints in our state, oh my God. You know, we've been working on that since I came. And that's probably the thing that makes me feel like the most ineffective human being on the face of the earth. But I say to myself, we don't know yet. Because, and now I really don't know because now we have Congress interested, so yay, maybe something good will happen. But I think one of the important things is, you know, the same way when we talk to parents and getting parents to have, you know, think about high expectations for their children and not think about all the things maybe some of the professionals told them and you know, you're in denial and all that kind of stuff. I think thinking about our own efforts as well and really doing an organizational self-assessment about where are we in systems change in our organization. You know, what are we doing well and what could we do better and where could we get help to do that better? And you know, what kind of leadership exists at your organization and with the parents that you work with and your friends and partners? Where are the gaps? What kinds of things do you already do that are building leadership or that could easily be adapted to build leadership? If you're working on something, how are you going to sustain momentum? You know, all of these things are part of an assessment of your organization's role as a systems change leader. And developing an action plan. I mean, it's like an IEP, right? So here's our strengths, here's our challenges, here's our goals, long-term and our short-term objectives. Here's the things we're going to put in place to make it happen, and here's how we're going to evaluate to see if it worked. So it's like the IEP for systems change is something that will help us move forward. At my organization, one of the things that we are really guided by is Margaret Mead, and she said, now I have to say she talked about citizens, and we don't talk about citizens because we have a lot of undocumented immigrants in New Jersey that we work with a lot. Never doubt that a small group of thoughtful, committed people can change the world. Indeed, it is the only thing that ever has. It was small groups of committed people who passed the Civil Rights Act of 1964, got the vote for women, established Social Security, set up public schools, labor rights, passed the first and every subsequent law guaranteeing education rights for children with disabilities. Democracy isn't a spectator sport. We are not going to change systems by sitting on the sidelines and ranting and raving about how everything is bad and everything is so unfair. If we want to make that change, we have to ourselves be committed to engaging children and youth with disabilities and their families in making a difference. And if we do that, that is its own victory. Even if this time we don't pass that legislation, even if this time we don't get the State Board of Ed to vote on that, even if this time we don't get the specific thing we're fighting for, because we're engaging people in making decisions about their own lives. So I want to close with just a couple quotes. People who know me know I love quotes. Why, recreate something if it already exists better than what you could do? So this is a song. I'm not going to sing it. It's on the computer, and I thought of playing it, but it's a very long version, so I'm not going to do it. To dream the impossible dream, to fight the unbeatable foe, to run where the brave dare not go, to right the unrightable wrong, to try when your arms are too weary, to reach the unreachable star. This is our quest, to follow that star, no matter how hopeless, no matter how far, to fight for the right without question or pause. And the world will be better for this, that we, scorned and covered with scars, anybody feel that way? Scorned and covered with scars? Still strove with our last ounce of courage to reach the unreachable star. And I'm going to follow that up with a quote from Alice in Wonderland. "There is no use trying," said Alice. "One can't believe impossible things." "I dare say you haven't had much practice," said the Queen. "When I was your age, I always did it for half an hour a day. Why, sometimes I've believed as many as 6 impossible things before breakfast." So I leave you with a challenge. Starting today, believe as many as 6 impossible things, dream the impossible dream, strive with your last ounce of courage to right the unbearable wrong, and be the pebble in the pond that causes ripples that spread in all directions. Because if not us, who? And if not now, when? Thank you.